Hello everyone and welcome to my channel. The theme of today's video is orthodontic elastics, indications and application. I'm Riri and I don't know if you know, but I'm a dentist. Also, I have worn elastics and I want to think that I know a thing or two about elastics. Also, this video was requested, so here I am making it. I hope I will do a good job and you like this video and the information that I'm about to give you. I want to talk about a little bit about elastics. So every elastic has its own size and every size can apply certain amount of power on the teeth when we are using it. So the size of the elastic is actually determined by the inner diameter of the elastic. They can be 1/8 of an inch, 3/16 of an inch, 1/4 of an inch, and etc. The power can be 3.5 ounces, 4 ounces, 5 ounces, 6 ounces. When we actually expand the elastic 3 times its initial size, this is the moment that we get its full range of power. And as I said, every size, like for example 1/8 of an inch, can come as 3.5 ounces, 4 ounces, 5 ounces, 6 ounces. And those characteristics of the elastics are on the package. So for example, here is what I have. On the package we have actually the size of the elastics. I think this is 3/8 of an inch, and the power of the elastic, this one is 4 ounces. Different brands have different names for the different sizes of their elastics, and this one is called jaw. Other brands have animals on the package, so my advice would be to know the type of elastics that you're wearing. You know, you can see the size and the ounces and you can remember them, or you can remember the name or the animal that is on the package. But if you don't want to do this, or you are afraid that you may forget, my advice would be to take a picture of the package, and if your orthodontist asks you, you pop the picture and you show them. My advice to you will be to apply your elastics the way your orthodontist told you to apply them. In this video, I'm going to try to give you the most common ways of application of the elastics, but I want you to keep in mind that every case is unique. My case is unique, your case is unique, so I may not cover the way you're supposed to wear your elastics, and that's okay. If you're not sure, don't do what I show, because this might be not the way you have to wear your elastics, and you can actually worsen your current situation, your current orthodontic situation, wearing your elastics the wrong way, and in this way you can prolong your orthodontic treatment. So call your orthodontist if you don't know how to apply your elastics. If today was the first day that your orthodontist gave you the elastics and you just came home from your appointment, my advice would be to wash your hands, and with clean hands elevate or kind of move your lips and cheek, and take a picture of the position of your elastics. So this way, in the beginning, when you're uncertain how to apply your elastics, you will see on the picture and you can do it. The other thing is you must wear your elastics. You know, you have to put them and also wear them the way your orthodontist told you. But in most cases, the elastics are worn all the time, during the day, all day, and during the night. I think we are not supposed to wear the elastics while we are eating. And I'm not gonna lie, I was very strict when it comes to wearing elastics. I wore my elastics all the time, even when I was eating, and I have swallowed a few of my elastics. Also, a few of my elastics have broken down in my mouth, and it doesn't hurt. You kind of feel hurt, kind of a pop, and when you open your mouth, you see that you have broken down your elastics. So in cases like this, I guess, and in general, my advice would be to have a few extra elastics with you all the time, so you will basically be prepared, because everything can happen. Elastics are worn, as I said, all day, all night, but we must change them every night. Before you brush your teeth, remove your elastics, brush your teeth, and put a new elastic or new pair of elastics in your mouth. When I was applying my elastics, I use my fingers, and sometimes it's kind of hard to actually remove them, because sometimes they kind of stuck between the oh my god, how is it called, the hook. They stuck behind the hook of the braces, and in those moments it's kind of pain in the A to remove them. So I used tweezers, clean tweezers, or you can use what else? I was using a hemostatic instrument. I got myself one from the practice, or recently my boss actually bought plastic hooks to help you to apply your elastics. I'm going to show you how you can use them. Elastics can be used only in one arch or in both arches at the same time. When the elastic is used only in one arch, those type of elastics are called intermaxillary or class 1 elastics. Class 1 elastics can be horizontal or vertical. Horizontal class 1 elastics are used usually when we want to move tooth or group of teeth in the horizontal plane. So basically they are mostly used when we want to close space after tooth extraction. Usually they are worn from the hook of the upper first molar to the hook of the upper canine. By the way, my upper first molar's braces hook is broken. Vertical class 1 elastics are mostly used when we want to do intrusion. Intrusion is movement of a tooth or group of teeth towards the bone. This action is actually assisted with the presence of mini implant. As the name says, it's a mini implant that it's screwed in the bone, and part of it is screwed in the bone, part of it is sticking in the mouth. Let's say we want to do intrusion of my upper lateral incisor. In order to be able to place elastic, I will need a hook around the brace. In this case, I will have to put the one end of the elastic around the hook and the other end around the head of the mini implant. Instead of my finger, the hook will hold the elastic, and above the tooth in the jaw will be screwed the mini implant. The other type of elastics are being used in both arches at the same time. Those type of elastics are called intermaxillary elastics, and the first of this group are class 2 elastics. they're being used in class 2 malocclusion. Normally, let's just pretend that these are my upper front teeth and these are my lower front teeth. In class 1, normal ideal situation, our upper front teeth are covering part of our lower front teeth and they are in contact. You see, they're in contact, but sometimes there might be a small gap of 1 or 2 millimeters, and that's totally okay. But when this gap is bigger, like 5 millimeters, 1 centimeter, 2 centimeter, this is not okay, and this situation is called class 2 malocclusion. So class 2 elastics are used in class 2 malocclusion, and what we want to actually achieve with those type of elastics, if our upper front teeth are fan-like positioned, so if this is their normal position, they're to forward, and we want to move them backwards basically, or if our lower front teeth are positioned too much backwards and we want to actually move them forward, or if we want to move the whole lower arch forward. Those are the cases that we use class 2 elastics. So class 2 elastics, they are positioned from the hook of the upper canine to the hook of the lower first molar. Or you can put it from the hook of the lower first molar to the hook of the upper canine. Class 3 elastics are being used in light cases of class 3 malocclusion. So class 3 malocclusion means that light cases of class 3 malocclusion means that the lower front teeth are contacting with their the edges of the upper front teeth. This is light case of class 3 malocclusion. In more severe cases, the lower front teeth are covering the upper front teeth, or they're few millimeters or few centimeters in front of them, and this is not okay. Remember, this is the normal occlusion. This is class 3 occlusion. So in light cases of class 3 malocclusion where we have edge-to-edge occlusion, what we actually want to achieve is to move the whole lower arch backwards. And the type of elastic that we use, I said, is class 3 elastics. So class 3 elastics, we put them from the hook of the upper first molar to the lower canine. Same placement but on the teeth on the right. So other type of elastics can be used in cases of open bite. Open bite means that when we try to bring our teeth in contact, they don't contact with each other. For example, for the front teeth, open bite means something like this, or like this, or like this. And for the back teeth, we basically have this situation. When we try to bring them in contact, they just don't contact. So when we use elastics, our goal is actually to do tooth or teeth extrusion. And extrusion is moving a tooth or teeth away from the bone. In open bite cases, we might use box shape of elastic placement.
Imagine I have hooks around the braces of my incisors. Put the elastic from the upper left lateral incisor to upper right lateral incisor, then to the hook of the lower right lateral incisor to the lower left lateral incisor. Next box shape is from the hook of the lower left canine to the lower right to the upper right lateral incisor and to the upper left lateral incisor. Last variety from the upper left canine to the upper right, then to the lower right lateral incisor and to the lower left. Holding the elastic because it won't stay without braces hooks.
In the back, we can have the situation where we have to put the elastic from
the upper first premolar to the second, then to the lower second premolar and to the lower first premolar. The other variation is from the upper first premolar to the first molar, then to the lower first molar and to the lower first premolar.
The other shape that we use in open bite cases is triangular shape. The most common application is
from the hook of the upper canine to the lower canine and then to the lower first premolar. Same placement but on the teeth on the right.
the other type of basically placing the elastic is V-shape. Usually V-shape is
from the hook of the upper canine, then behind the hook of the lower canine to the hook of the upper first premolar. And reverse V from the hook of the lower canine, then behind the hook of the upper canine and to the hook of the lower first premolar. Same placement but on the teeth on the right.
The next shape is W shape. We usually use this type of shape in patients with class 2 malocclusion with open bite in the back region.
Put the elastic on the hook of the upper canine, then behind the hook of the lower first premolar, then behind the hook of the upper first premolar, then behind the hook of the lower second premolar, and to the hook of the upper second premolar.
same shape of placement is used in patients with class 3 malocclusion and open bite in the back region.
Put the elastic on the hook of the lower canine, then behind the hook of the upper canine, then behind the hook of the lower first premolar, then behind the hook of the upper first premolar to the hook of the lower second premolar. Same placement but on the teeth on the right.
Vertical elastics are being used in cases where we want to close open bite between tooth and its adjacent tooth. Let's say that we want to close the open bite between our first premolars.
Place the elastic between the hooks of the upper and lower first premolars.
Or it might be around the second premolars or around the first molars.
Place the elastic between the hooks of the upper and lower second premolars.
Another type of elastics that we use is cross elastics. So cross elastics might be used in two situations. First situation is when the lower first molars are tipped towards the tongue, and usually they have bands around them, and the band have hooks on the part that is facing the cheek and on the part that is facing the tongue.
Place the elastic on the lingual hook of the lower first molar to the vestibular hook of the upper first molar. The elastic contacts the lower molar's crown and tips it toward the cheek.
The elastic will be diagonal and it will come in contact with the crown of the lower first molar, and with this contact it's going to put pressure on the crown, and it's actually will help with tipping the crown towards the cheek. And the other situation with the cross elastics is when the upper first molars are tipped towards the plate. Again, they are having bands around them.
Place the elastic on the palatal hook of the upper first molar and then to the vestibular hook of the lower first molar. The elastic contacts the crown of the upper molar and tips it towards the cheek.
And this is the tooth. Basically, this is going to be the position of the elastic. It's going to be again diagonal, and it's going to put pressure on the crown of the upper first molar, and this way it will help with tipping the crown towards the cheek. The last application of elastics is in finishing phase. Finishing phase is actually the last phase of the orthodontic treatment before they before they remove your braces, and the last part of the finishing phase is called settling phase. And basically in settling phase, finishing phase is the moment that some orthodontists think that now is the time to use elastics, and the goal here is to get a better vertical coverage. Usually the orthodontist will keep the whole wire for the lower teeth, but in the upper teeth they use sectional wire. sectional wire means that we don't have a wire that goes from, let's just say, upper first molar to the other upper first molar. It's partial wire. Usually it's in the front region. It might be from lateral incisor to the other lateral incisor, or from canine to canine. It might be in combination with sectional wire in the back region, let's just say from first upper molar to first upper premolar, or some sort of combination depending on the situation of the patient. And usually the type of elastic that they use is triangular elastics.
Put the elastic around the hook of the upper canine, then to the lower canine and lower first premolar. Same placement but on the teeth on the right. It may be in combination with elastic around the hook of the upper lateral incisor, then to the lower lateral incisor and to the lower canine. I couldn't do this combination, and that's why I'm including this picture.
Or it might be some sort of a box shape for the back teeth. It's different, and it depends on the, as I said, on the diagnosis and the situation of the patient. Thank you for watching. I hope this video was helpful and useful. Don't forget to like it and to subscribe to my channel. Bye!